Alrighty, so what we're talking about today is healthcare. And apparently, that is the number one concern for Canadians is to get healthcare. And I just did some quick research. Basically, about 13% of the GDP from Canada is spent on healthcare. And in America, apparently, it's around 18%. But really, is it private versus, public healthcare? This seems to be basically the only debate going on. And then basically all that's really happening is throwing some numbers on how much is being spent between the two. And then that seems to just basically be the only thing that decides what's better. Okay. And really, when I look at healthcare, I don't just look at it as public versus private. Okay. But I do think having both is a good idea. But beyond that, more about the micromanagement on incentivizing. Yes, I talk about this a lot, but incentivizing healthcare. Okay, and the reason is right now there basically really is no reason to be healthy besides being healthy, right? Because being healthy feels good. But for example, in the universal healthcare system where healthcare is always free, you don't really care when you get sick. You don't, because you know you're always going to be getting the healthcare, right? And when healthcare is always free, you don't really care when you get sick because you know that the bills are always being covered. Okay? And, at the same time, when healthcare is exclusively privatized, and then you do get sick, and then you realize you can't afford to get healthy, well, then the citizen basically becomes incapacitated with no ability to be able to heal properly, and then they actually can't really come back to society as a valuable member that contributes by being healthy enough to work and do these kinds of things, right? So, once again, if you can't pay the bills, that's not good because then you can't get healthy. But when you don't care when you get sick because the bills are always covered, that's also not good. That's also not good. Okay, so it's not really just the marriage between public and private healthcare, but more addressing the root causes of why healthcare costs are always rising. They are. I mean, you can certainly research it for yourself. But more money is being spent on healthcare all the time. Considering, is it just population growth? No. No, it's not. It's not. It's just that people are getting sick more often. And really, it's mostly just because people know, it's always going to get paid for, right? Anyways, so talking about the root causes of health and getting sick, right? How can we address healthcare and make it something that when you are the healthy person that never needs to get any healthcare, how can this be beneficial to you? And how can you be somebody that inspires other people to be healthy as well? Okay, because ultimately, an empty hospital is not a bad thing. No, it's not. Okay, because if everybody is healthy, then everybody is not taking a sick day off work. Okay, which means society is functioning at a premium, right? And if you do work at a hospital and it is empty, the good thing about that is you still need to be there. Okay, you still need to be there. You still need to go to work and you still need to do your job. And if the hospital is empty, besides the staff, the reason that is a good thing is when somebody does get sick, yes, you're getting service right away. Okay, right away, because everybody is ready to go. And is the hospital always going to be empty? Probably not. Obviously, right? Because people do get sick, right? But people sometimes get sick because of what happens to them. For example, a car unfortunately hits somebody, Okay, and that would not be their fault. No, it wouldn't. Right? And it's quite understandable that when somebody hits you with the car and then you need health care, that yeah, it should be provided, right? But should it be at everybody's expense, or should it be exclusively from the person that hits you with the car, right? And at the same time, when you do get sick of your own means, and you do it to yourself, is it fair when everybody else has to pay your bills when you're doing it to yourself and they are not, right? And this is the discussion that I want to be talking about today because I kind of want to set the spark to set the fire up for the conversation on how healthcare can be amended to be something that is, yes, more logical. That makes more sense. Makes more sense. Okay. So let's take the example of we'll start small. We'll start small. Okay. And there's only 10 people living in a nation for some reason. There's only 10 people. Okay. And all 10 people all make $100 every year. Now, obviously, you make more than $100 in a year, but it's just a nice, easy number to work with. Okay, it's just hypothetical. It's an example. Okay, so there's 10 people that live in a nation. They all make $100 a year for some reason. Okay, and that's all they make. But that's for some reason the currency is very valuable, and that's all they need. Okay, so every year. 3 out of those 10 people need hospital care, okay, in a serious way. So, like maybe something like surgery. And then 4 out of 10 out of those 10 people need hospital care for, something not so serious, but, maybe like a third-degree burn or something, right? They burnt themselves on the stove or something, something kind of more like that. And then maybe 2 out of 10 needed to, then maybe 6 out of 10 where we're going to a hospital or even just like a clinic for something that was quite minor. Maybe like, like a really bad stomach ache or food poisoning. Okay, something just more minor. Okay, that's very temporary. Okay, so what happens is, let's say out of those 10 people, when, let's just say 2 of them have like extreme healthcare problems, and then those 2 people also have major problems, along with, let's just say, 4 of them, okay? And then 6 of them have minor problems, which is also the 2 people that had extreme problems as well as the 2 people that had major problems, which means there was 4 people that were healthy all year round out of the 10. Okay. Hopefully those numbers weren't confusing, but I'll just go over them one more time. 2 people had extreme healthcare problems that needed to be attended to. Those same 2 people also had 2 major problems, but then there was also 2 other people that had 2 major problems, so that's 4. And then these 2 people that had extreme problems with major problems also had minor problems. These 2 people with major problems also had minor problems, and then there was 2 more people that had minor problems. Okay, which then leaves 4 people out of the 10 that had no problems at all. Okay, so now what happens is they all pay $10 out of the $100 that they make in the year. Okay, for healthcare. And in this example, again, these are just hypothetical numbers, but it just makes it really easy to talk about. Okay, so obviously it costs more than $10, right? But so everybody's chipping in $10 out of the $100 that they make, which is 10% of their income, right? And now that $10 is being paid for everybody's healthcare, and it covers all the costs. Okay, it covers the cost of the 2 extreme cases, the 4 major cases, and then the 6 minor cases. That $100 covers the cost for all that stuff to get done. Okay, but then there's still 4 people that were healthy all year round, and they pay $10 each, which is 10% of their income, and they never had to use those services. They were always healthy. and they were still paying into something to, make sure these people were healthy so they could, get back to work and all these things, which is good. But is it fair? Right? Is it fair? And that's why I want to talk about this, because it's not fair. Okay, and it means that those four people now are, contributing towards the people that are getting sick, and they're taking care of themselves, and they have to pay the exact same amount as the other people that are getting sick. And not only that, but the two people that had the extreme health problems, the two major problems, and the two minor problems of health are still paying the same amount as the other four guys that didn't need any help at all, right? So it doesn't really make sense, right? Because now these four guys are saying, how come I'm paying, just as much as the Joe Blow that had two extreme problems, two major problems, and two minor problems? Shouldn't that guy be paying more, right? Well, yeah. Yeah, actually, that makes a lot of sense, and that is a very logical thing to say, right? Because when you're the guy that's healthy all year round and you're paying just as much as the Joe Blow that's having all these health problems, and like, how come you have to pay so much for him when he's always getting sick? How is that fair to you? Okay. And you still want to make sure that Joe Blow is getting the health related work being done so that he heals. But how can it be fair? Okay, how can it be fair? So this is how you can start incentivizing health. Incentivizing health. So supposedly, if there was a flat rate, right, where everybody was supposedly paying 10% of their income. I actually talked about this in one of my previous videos. But when Joe Blow is getting extreme healthcare needs and then a major need and a minor need, I call it the three strikes you out. Okay, and it's not that you're out, but after three strikes and you started using the healthcare program, and you did this sickness to yourself because you didn't get hit by a car, you didn't get food poisoning from a restaurant, because that wouldn't be done by yourself either. But you weren't taking care of yourself. You weren't eating, you weren't sleeping properly. You went outside for a jog in your underwear for some reason and got pneumonia. Right? That means you did it to yourself. Okay. So what happens is there would kind of be like a grade as well, because when you need extreme health care, it's kind of more than one strike now, isn't it? Right? Yeah, it is. It's almost kind of like three strikes already, because you needed extreme healthcare, and you did it to yourself to need that extreme healthcare, and the extreme healthcare, yeah, costs more. Okay, costs more. Okay, and then the major one, would be like a two strikes, and the minor would be like a one strike. Okay, and maybe not to go out of baseball land, but it might make more sense for it to be five strikes. Okay, because then you could have like an extreme. You could then have a couple minors, or you could have two majors and a minor, or you could have one extreme and one major, and then you would have five strikes, because the three and the two would make five strikes. And then let's just say you had a minor after you had your extreme and your major, and then you're on, you did your five strikes. It's all within the same year, and then you had a minor, okay, and you had a minor healthcare related issue. Now, what happens? What happens? So what happens now is when you're doing this to yourself, now your life and your finances are no longer solely in your control, because you're being proven to not take care of yourself. And basically what happens now is you might not even live in your own place anymore when you can't take care of yourself, being an independent person. Because the more you're getting sick, living independently and having the freedom to make yourself sick, the more likely it's going to be that you're going to have to live in a supervised home, being monitored, and your finances will still be your finances. I'm sure you could still even go to work and stuff, but basically what's happening is you're basically being monitored and supervised now, because the idea is you got to stop getting sick. Gotta stop getting sick, okay? Because it's not fair to those four people that are paying for you to, have to always have the healthcare costs for these 4 people that never have to get any healthcare always being paid for you, right? Which means the more you're getting sick, the more you're going to have your freedoms taken away. Yeah, and it's only fair, right? And as for some people, that might sound scary. Okay, that might sound scary. My freedom's being taken away. But really, what is scary is people making themselves sick all the time, and thinking that that's okay, because it's not, and it's not fair. Okay, because if you can't take care of yourself, you need to be taken care of. Okay, and it's not fair when these people consistently get out of the hospitals and then they just make themselves sick again and just go straight back. Okay, doesn't make any sense. It's not logical. So now what's happening is, you had the extreme, you had the major, you've got the 5 strikes, you're out now, and it's not like you're out, but now you're on thin ice. Okay, you're on thin ice, and now you realize, oh, geez, I really better take care of myself. And yeah, you should. Yeah, you should really take care of yourself. Okay. This becomes the motivation now, because you realize that you made yourself sick. You had your 5 strikes, you're out now, and if you get sick again, now what's in the back of your mind is, oh wait, if I make myself sick again, I'm going to have some of my freedoms and liberties taken away from me. And nobody wants that. Nobody wants that. But that is how this penalty of freedoms and liberties being taken away, when your finances are no longer really something that you are liberally spending and having the freedom to spend exactly how you want them, or you're not exactly living independently anymore. You're living in something more like a group home, maybe, or kind of like a supervised setting or something. Or even if you were like a senior citizen, it would be the difference between you constantly making yourself sick and living independently, maybe in an apartment. And when you keep doing that to yourself and you've used all your strikes and you're out now, now you're living in the retirement home where you're being supervised and monitored. And, it's only fair, okay? Because maybe you don't care when you get sick, but you should, okay? Because it doesn't feel good to get sick, and it's not fair when everybody else that's healthy all the time is paying for it, and you just don't care when you get sick because it's always being paid for, right? And so when people realize, oh, geez, I'm not going to be able to spend my money on whatever I want. Once I've used all my 5 strikes, and then I'm out and I have to have another strike against me, right? And oh geez, I might have to live and have my independent living taken away from me, right? And this, it probably scares some people, but the idea is not for it to be scary. The idea is for it to be the motivation for you to be healthy. Okay, because you should have the motivation, and you should be penalized when you keep making yourself sick at the burden and the expense of others that are taking care of themselves. Yeah. Okay, so this is basically how when you have like this kind of strike program. Again, it's not baseball we're playing here. This is obviously healthcare. But the idea is that when you're getting sick and you're doing it to yourself, you get strikes against you, and it's all within the annual kind of year that these strikes take place, which means in the new year they get renewed. Okay. But this is how we can combat the mentality of people that don't care when they make themselves sick. And what happens when it's the restaurant that gives you food poisoning? Yeah, that's right. Then the restaurant gets the strike because they're the ones that did it, right? And what happens when it's the person that hits you with the car? That sounds like an extreme healthcare related issue, and it's the person that hits you with the car that then gets the 3 strikes, right? Because it's who does it, right? It's who makes the person sick. So it can be you making yourself sick, or it can be somebody else making you sick, right? And it can be kind of a challenging thing to understand who's making who sick, right? But you got to start somewhere. Okay? And actually, all these things can be a lot easier when everything either has a paper trail because everybody is paying things with bank cards or something like that, and then we use digital currency instead of cash, so everything does have a trail. And this also is a lot easier when we have surveillance and cameras everywhere. No, it's not like they're in your home, but at the same time, when it's seen in public how you're getting sick because you're running through the river valley in your underwear and you're drunk off your bum, and then you're going to the hospital with pneumonia, right? While the camera saw you running in the river valley in your underwear, so we know you gave yourself pneumonia, right? So anyways, it becomes a lot easier with the cameras and surveillance. And let's face it, even when the cameras don't have to be in somebody's private home, when they are getting sick and they were in their private home and there's no evidence that it came from the public where surveillance cameras would be, well, yes, then they did it to themselves, right? Unless, they had a spouse or someone, not to talk about something tragic, but, let's say, the guy was beating up his spouse or something like that. Obviously, the strikes would be going against him. And obviously, yeah, he should go to jail too. But, it's we're not really at a place where we can be having surveillance in people's private homes. Because obviously people want to be doing some things that wouldn't be fair to them for it to be monitored. But yeah. So anyways, this is how we can start having, surveillance and monitoring to make it easier to understand who is making who sick and who is making themselves sick, and how the strikes can be applied, and how the motivation to be healthy can be applied by having freedoms and liberties and amenities taken away from people that are constantly making themselves sick. Okay, and then what about the guys, or girls, whatever, that I use guys in a unisex way, so it's males and females when I say guys. That's just how I do it. Anyways, so let's just say there's 4 guys, and they're healthy all year round, and we're back to the 10 people that live in the nation, right? And they're paying the $10, right? Well, you were healthy all year round. You never had to go to the hospital. You never used any of your 5 strikes all year round. Now, is all we want to do is just give them a round of applause? Maybe a little pat on the shoulder, on the back? No. We want to do more than that. And the reason we want to do more than that is because when it's the person that's being healthy all year round that gets, some kind of substantial reward, and then the other 6 people that were getting sick see the 4 people that are getting the reward for being healthy all year. That's right, it becomes another way of motivating health and incentivizing it, okay? So again, another example is, I don't know, maybe like some kind of gift card. You could even ask these 4 people, like, what are things that you would want as a reward, maybe it's just if they're making $100 a year and they pay $10 into the healthcare, maybe they get $5 back, because really that is 5% of their income in this example. Or maybe they want like a gift card to something that they enjoy doing. I don't know what it would be, but maybe you would want to ask them, really, because, asking you shall receive. But so basically now these 4 people that are healthy all year, when they get that reward and they didn't use any of their strikes, it's not just congratulations, you did it. It's here's the bonus, okay? It's almost like getting a Christmas bonus, right? Like, good job. And now when you get your health bonus because you were healthy all year round, then the people that were sick were saying, geez, I want that reward, okay? And how is this reward actually something that is realistic and practical in emerging is actually very simple, because when 4 people are healthy all year round, they're not taking any sick days now, are they? They're not taking time off work, which means they are contributing more to society, they are giving more, and they're not costing more, okay? Which means it is already makes sense for them to be rewarded more, because they are doing more, and less has to be spent on them, and they are giving more back to society. So it already makes sense, okay? And then the people that are getting sick, they look at the people that are getting healthy, and they're like, I want that bonus. Yeah, you should. You should, right? And it's better than using a bunch of your strikes and then having, your liberties and freedoms taken away. And yeah, so then you can get bonus. And the reason is guess what? If all 10 out of 10 people that live in this nation were all healthy, yeah, they'd all be working all year round. They would all be never using the healthcare system all year round. So, the healthcare workers would be ready to go, right? But at the same time, if that hospital was empty all year round for some reason and nobody had to go to the hospital, well, guess what? That just means that there's more money for something else instead of all the things that have to be applied to healthcare. Okay, and this is why an empty hospital is not a bad thing. It's not. Okay, because an empty hospital is good for just so many reasons. Because really, you can still keep the lights on, right, in the hospital. You still have to go to work. Okay, you still have to go to work because the idea is you have to be ready for when somebody is sick, which means, yeah, you still have to go to work. Okay, now are you just twiddling your thumbs or something, when you're at work and you're at the hospital and nobody's there? Well, when there's only 10 people living in the nation and all those 10 people are healthy all year round, it's kind of a different story. But, when there's tens of millions of people that live in your nation, obviously your hospital is not going to be empty all year round. Okay. But the idea is to make it emptier, because when the hospital is emptier of patients and it is full of staff, then we are not spending a bunch of money on supplies. Okay. We are not spending a bunch of money on, you still need to go to work in the sense that, yeah, your wages, are being paid. But really the bulk of what needs to be spent on the healthcare system is not the workers, but the supplies, the power, the electricity, the resources, all the things that they need. I've actually researched it myself this morning. It is the primary cost. Is what the infrastructure, the resources, the materials. It is the primary cost of the healthcare system, not the workers. Okay, and when you realize this is the primary cost, the emptier the hospital is of patients, the more this money gets freed up, and it gets freed up in multiple ways because these people are still getting paid their wages. They're now helping the people that are getting sick faster because obviously there will be less of a lineup. Now more people are not taking sick days, which means they are working more, which means they are contributing more to society because really, like I said in one of my previous videos, what makes the world go round isn't money but work, right? So when you realize that universal health care always sounds pretty. It does. I'm always going to get health care for free. And it does sound nice. But now that we've been practicing universal health care, sometimes basically people just go to the exact same arguments all the time, public versus private, and you guys just kind of want to eat each other up and you just fight each other. And really, it's about coming to an understanding of how to have a more practical and realistic answer that everybody can agree upon. Okay? And this is why I'm talking about healthcare the way that I am talking about it, because the way that I'm talking about it is fair. It's fair. And not only that, it's logical. Okay? And guess what? You know what? Obviously, when there's lots of people out here, you know what the other benefit is of having a mix of private and public healthcare? You know what? If you do make a lot of money, and you don't want to use the public healthcare system, and you do spend your money on the private healthcare system because you do have lots of money, that is a good thing. And it's because the private healthcare is paying more taxes as opposed to being something that the government is just spending money on, not really generating any taxes at all, right? But at the same time, when the guy that has more money is going to the private healthcare system because he can, and he spends his money on that, that's actually good for the people in the public healthcare system. You want to know why? Because now he's not in the public healthcare system, which now he's freeing up one of the hospital beds for one of you guys that needs it, okay? And so why would that be a bad thing? Okay, why would that be a bad thing? So is it public versus private? No. It's just about understanding. You want them both. Yeah, you do. Yes, you do. Okay, and I just explained that, right? Because the person that can't afford the health care, that is still working a job and paying some taxes, they can still get that health care, but they're in the 5-strike program or whatever it is, right? So that they know, I don't want to get sick too much, because I don't want to be doing that to myself, or else, I might not be living in my apartment anymore, or I might not have control of my finances, and nobody likes these kinds of things, but this is how it becomes the motivation. And then the guy, again, that's maybe the CEO of, I don't know, whatever, some kind of company, no point in naming names. Now he's saying, well, I'm going to the private healthcare program. I've got lots of money. I'm going to be able to afford this all by myself. And that's good for the Joe Blow that can't afford healthcare going into the public healthcare program, because when he's going to the private one that he can afford, now Joe Blow going to the public healthcare program has the hospital bed free because that CEO is not in that bed. Okay, and it's free now. So it does free up more in the public healthcare program when there is private healthcare that people can spend to afford that healthcare and get the care that they need. Yes, right away because they have the money, but it also means that the people that are getting the public health care also get it, yes, quicker, because now there is the option of taking one or the other, which means the public health care system is not being oversaturated when everybody has to use it, because there are the people with more money that can use the private healthcare program. And, it's not about being jealous of them because they have the money to pay for that healthcare. Because you know what? When they pay more taxes than the person that's making less money, guess what? They're paying more money for the public healthcare program. Okay, because when you make more money, you pay more taxes. Okay, so it's only fair. Okay, it is only fair, and that's why it's not. You're not jealous of the person that has the more money, that is paying more taxes into your public healthcare programs, that pay for your bills that you cannot afford, and then they get access to private healthcare right away because they have that money. Because they're paying the more of their money that they make in a year towards the public healthcare program that you can't afford yourself. So obviously that's fair. Yeah. Okay. So again, this is how you incentivize health. You realize, no, it's not the battle of private versus public. You guys just got to get over it. You need to see the bigger picture, and you just marry each other. Yes, not literally, but you marry the two together, okay? Because it's not one against the other. You realize, oh, geez, we could just work so much better together when we just have the best of both worlds. Yes, you can. Okay, and this is why I'm talking about this. And again, the 5-strike program or whatever it would be, it's there because, if you're making yourself sick over and over and over and over and over and over and over, okay, and there's never any penalty for you to get sick over and over and over and over, that is not fair. That is not fair. And literally, when that is the case right now, for example, in Canada with this universal health care, someone can get sick and they can do it to themselves over and over and over and over. And, they never get penalized. It's just, we'll always heal you. We'll always help you out. And no, because a lot of people take advantage of this system. And the reason they take advantage of it because they know when all these bills are being paid for that they can't actually afford themselves. The way they take advantage of it is when they're spending time there, they're not working, and everything's being paid for them, right? The food's being made for them. Their sheets are being made for them. The laundry's being done for them, and it's just another proponent, like I talked about earlier, socialist communism. It's just promoting people to be lazy when you tell them that you're always going to help them when they're sick. And, that sounds all fine and dandy at first because obviously we all want to be healthy, but people take advantage of it because when they always know it's free, they sometimes get sick because, that seems to be financially the best thing for them to do. And in fact, sometimes it's even the best thing for the homeless person to do that I talked about in one of my other videos previously. But a homeless person sometimes will get sick on purpose. I see it. I live right here in downtown inner city Edmonton. It's like I'm not oblivious to this stuff. Am I that homeless person going in there? No. But do I see it? Yeah. And it's very obvious. It's very obvious. Basically what they're doing is they're looking for a free trip. and they're looking for things to be paid for. And although they're homeless, they actually do want shelter. They do want food. They don't want to be out in the cold. They don't actually like it. I know what they don't like. They don't like having an address. They don't have it like having the government have a little identification card, and they don't want to have an address because then we can send a fine to your address when you do a crime. So whatever. But yeah. This is just one example, and literally, it's not just the homeless people; it's all kinds of people. But all kinds of people take advantage of the universal free healthcare program that we have here in Canada. In fact, some people actually come from other countries sometimes just to come down to Canada just to get the free healthcare. Because you know what? Sometimes it really does cost less for you to go across the border from the United States, being a dual citizen, right, with dual citizenship, and you'll be saying to yourself, well, geez, all I have to do is go across the border having dual citizenship, and then I can have all my healthcare costs paid for by the Canadian taxpayers. And then I'll go back to America and get healthy again, and then maybe get sick and do it all over again. Like, that's obviously messed up, right? And this is how universal healthcare is taken advantage of. Because unfortunately, humans just tend to want to do what is best for themselves. Greed. Yeah, it is kind of human nature. It's just the way humans are. But this is why I talk about these things. Because greed, being avarice, it is the root of all evil. And I'm not saying humans are evil, but they kind of inherently are. And the way to not be evil is to be conscious on how to be good. Okay, how to be good. And because humans typically are not able to do this for themselves, this is where the government comes in and makes these programs like I'm talking about to instill it in society so that it can be manifested as opposed to something we just hope for, right? Because, I mean, even Confucius talked about it. Confucius did Confucianism. He was like an ancient Chinese kind of like philosopher that was really developing a code of laws. And he talked about the same thing, Confucius, that humans are inherently evil. And is it a bad thing? Well, yeah, it kind of is. It kind of is. It's just that typically humans want to do what's best for themselves. Okay. But that doesn't mean that's what's the best thing for themselves, because what's always the best thing for somebody is what's best for all mankind. Okay. And you got to look at the bigger picture of things. And, when you're the government and it comes to understanding the way that people are, you have to, make, programs. You have to make, legislations, laws, things that have rules in place so that these evils can be something that people become conscious of as opposed to being oblivious to them. And, it's not about stabbing at human nature and saying you guys are all evil. It's just about how we can be conscious of how to be good. Because you do have to be conscious to be good. You do have to be aware of the things that you're doing. And you do have to understand the aftermath of your actions and how it carries forward towards the tomorrows of tomorrows. And, lots of people, they say, be here now, be here now. And that's good. It's good to be here now. But the better be here now is the be here now that is thinking about how the now is affecting the tomorrows of tomorrows that have not yet come, but will come. Okay. And the reason I say this is because it's very obvious that governments are spending more money on healthcare all the time. And is it just population growth that is the root cause of the sole means of why we're spending more on healthcare all the time? No, it's not. And again, that's why I'm talking about what I'm talking about, because it doesn't matter if there's more people or the same amount of population. How can we spend less on healthcare so we can be more healthy? Okay, because that is the goal of healthcare, is for people to be healthy, not just to know that they can always be healed when they get sick, but how to be motivated to be healthy instead of being sick. Okay, because when people again are being told that they will always be healed when they get sick, then it just becomes this mentality where they're like, well, geez, if I'll always be healed when I get sick, I guess I don't care when I get sick because then I'm not at work. And then I don't even have to cook because I'm just getting the hospital food. And, you see, this is just kind of how humans think. And I used to think like that too. And, maybe every once in a while I do think like that, okay? But I also know that to be consciously aware of these things, I then become the better man. The better man, because I know that when we start promoting a sick society, we actually all get less. We don't get more. And if you want to be greedy, guess what? We can all realize that when we're all healthy, okay, we actually all get more because we're all doing more, okay, instead of just sitting or laying down in a bed. Yeah. And so if you want to put greed into the situation and how greed can be something good instead of something evil, think about how when we are all healthy, you'll feel better because yes, health is wealth. It feels good to be strong. It feels good to be healthy, right? It's a good feeling, right? It's not like you enjoy going into the washroom and throwing up into the toilet. It's not a good feeling, right? But when that financial kind of bonus of throwing up in the toilet and going to the hospital is there because you're not working, then you become motivated by money to do these kinds of things, which is sick. It is sick. It is very sick. Because when that becomes the motivation is how you can monetarily gain from becoming sick instead of feeling good and being healthy, that is twisted. That is twisted. And so, yeah, it's about addressing how we're doing healthcare today. We're marrying private and public together because, yeah, you got more money. Yes, you should go to the private healthcare program because now the people in the public healthcare program have more hospital beds freed up because you're going to the private healthcare program when you have the more money. And you're paying more taxes towards the healthcare, public healthcare program. So, thanks, right? Appreciate that. And so yeah, don't be jealous of the guy that has more money spending for the private healthcare, okay? Because that guy is also paying more money for your healthcare that you can't afford, okay? So you shouldn't be jealous of that guy. You should be thanking him, okay? Yeah. And once again, the strike program. Eventually you're gonna be out, right? And is it you're out like we're gonna kill you because you're out? No, just relax. No, it's not that kind of out. But it's only fair that when you're out, what is out is your freedoms, your liberties, and your independent living and control over your finances and these kinds of things, right? Because when these things are taken away from you, how do you get them back? You get healthy, okay? And that's how you get them back, and that's how you become motivated to do that. And then the other guy, right, that's healthy all year round, or maybe just use one strike because he just had to go to a clinic maybe because he got a wart on his foot, like some athlete's foot, blah 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 blah, right? He only used one strike, so he's good. Yeah, that guy should still get a reward. He only used one strike out of the 5 strikes, okay? Still costs less for that guy to only get one strike instead of someone that's using 5. Okay, which means there would kind of be like a reward level tier where if you were at 0, yeah, you get the biggest reward. If you only use one strike, you get a little bit smaller reward, and then 2 strikes and so on and so on. You get the idea, right? The more strikes you're using, the more likely you're not going to have any reward at all and a penalty. Yeah. Okay. And this is how we address healthcare. This is how we understand. No, it's not public. It's not private. It's about both. And it's about having the incentive to be healthy. And it's about letting people know that when they work towards being healthy, they will be rewarded. And if they do make themselves sick, they will be penalized. And other people that make other people sick, yes, you will be penalized. Yes, you will. And it's not really because if you own the restaurant, right? Actually, it has happened to me. I don't need to name names, but I have been poisoned by restaurants many times. And it's quite hard to prove all these kinds of things, But again, talking about the proof, who's making who sick. Basically, what you want to do is you want to have every transaction going through a digital currency for starters. Okay. because then every single transaction becomes something that has a trail. Okay, which means you can kind of go back in time with the transactions and figure out where everything is coming from, and it's a start. Okay, obviously surveillance with the cameras is another great thing because the surveillance of the cameras is a lot more about understanding who's making who sick. It's about understanding who the criminals are, which I'll tie into another video. But yeah, and you know, because again, if you're making yourself sick, that's a strike on you. Someone else is making you sick, that's a strike on them, and because that's fair. That's fair, right? Anyways, that's my 2 cents on healthcare and how we can make it better by making it something that makes more sense. Because what makes more sense is logical, and what makes more sense makes more sense. That's right.